It's that time of the week where we answer some of your common health questions. Joining me is News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. You know, we should be talking about healthy Halloween candy because we have some students visiting in our studio today,
Yes,
not the topic.
But they look like they know what they're doing.
I think they do. They look pretty smart over there. Let's talk a little bit about caffeine. Can it actually reduce your risk for Parkinson's disease?
Yeah, you know, Parkinson's disease is a very debilitating disease, and I mean, it affects millions of people worldwide. And what it does is it affects the motor neurons where you develop problems with walking and tremors. Well, more and more studies are showing that coffee and or caffeine has a relationship in a positive way where when you drink it, you actually improve your symptoms or delay the development of the disease. Most recently, 8,000 people were looked at over the course of about 25 years. And what they showed was that if you drank 4 cups or more on average per day, you had a 5-fold reduced risk of developing the disease and certainly improving the symptoms. So it's pretty impressive. And it's probably because what it does is it antagonizes the receptors that are involved in Parkinson's. And so when those bind to it, you actually then have more smoother muscle movement, and thus their symptoms are improved.
You know, caffeine gets a bad rap, so nice to see that
finding
it
more and
could
more
help.
coffee is like a miracle drink, really.
Oh, I drink it every morning.
Me
Trust
too,
me, I know.
too.
I'm up at 2 a.m. The flu, really good question, very, very timely. How long is someone contagious with it?
Yeah, well, as you know, and as we've talked about, the flu is transmitted and contagious through respiratory secretions. And some people are contagious even before they develop the symptoms of flu. Sure. But for the most part, you're contagious within 24 to 48 to 72 hours after the development of those symptoms. Symptoms being fever, cough, congestion, sore throat, myalgias, muscle aches, and a headache. Sometimes the nausea, vomiting, and the diarrhea as well, but for the most part, that's going to happen late. So once you develop those symptoms, you're going to be contagious within 24 hours and then up to 5 to 7 days after that. So I always, like we talk about over and over again, prevention is the key. Cough into your sleeve, into a tissue, wash your hands each and every time, especially after you've touched public surface.
You might be feeling better, but you still could be contagious.
Absolutely.
All right, Doc, thanks so much. If you have
You're
a
welcome.
question for Dr. Soria, you can send it in by going to our website. That is WPTV.com. Click on the health link, scroll down on the right-hand side. You're going to see a form, write your question there, and we look forward to sharing those questions with you. We look forward, Doctor, to you answering them. So
Thank
a lot
you.
of great advice. We'll see you next week.